So I'm reading out a Brain Saver. We're talking about blood draining agenda. And if you're somebody with chronic illness, you're somebody that knows somebody with chronic illness, this is critical information. Now, I just want to start out that I am all for blood testing. I believe in it. I think it's a great thing. But there is so much to know that is imperative for people who are struggling with symptoms and conditions, especially neurological symptoms and conditions. So I'm going to just crack right into it, you guys. Sit down, get a cup of tea or whatever, herbal tea or whatever you would like to do, because we're going to do some learning because this thing is packed and this chapter is jammed packed. So we got to do it. So working on your healing process while trying to live your life is difficult when you're encountering stressful situations, pollution, chemicals, environmental disturbances, exposures every day that we're up against, including exposures to the many sources of toxic heavy metals and pathogens we're up against too, which a lot that I talk about in the Medical Medium book series. There are numerous obstacles in the way of healing, and those obstacles are hard enough. Reason why it opens up like that is because we're already dealing with so much around us everywhere. Okay. Especially if we're sick and struggling. Trying to heal is difficult all on its own. Then there are obstacles in medical treatments and testing that are never accounted for or considered. These obstacles can interfere with someone's healing and recovery or with staying healthy and strong. Neurological symptoms especially can create the most mystery, which leads to more testing. So if you see where I'm going right there, you got a symptom, you don't feel good. You got tingles, numbness, aches and pains, pain in your jaw, pain in your neck, tremors, shakes, blurry eyes, brain fog. I'm just listing a few, right? And you're going to the doctor. So we got to do tests and more tests. And then you go to a specialist and we got to do more tests and more tests. So these obstacles can interfere with someone's healing and recovery or with staying healthy and strong. Neurological symptoms especially can create the most mystery, which leads to more testing. So when you have those symptoms like fatigue, where your legs feel like sandbags, anxiety and panic attacks, and you're going to neurologist, and it's like, well, I got panic attacks. My arms go numb. My legs feel like sandbags. I got fatigue. It leads to more testing, which in turn leads to a greater drain on someone's system. Get ready for this. Blood tests are at the top of the list for being a drain on the brain, right? Literally draining all body systems of the blood that's critically needed to keep you balanced and stable. With sickness and deaths rising to levels we've never seen before in history, it's actually crazy to the degree it's happening. Blood tests are going to be administered more than ever before in history. So think about that. More people dying than ever before. More blood tests are going to be administered. More people sick than ever before in our history, modern day history. More blood tests are going to be administered. We all find common ground with getting our blood tested, do we not? We do. It's a window into picking up important clues so your doctor can keep an eye out for your best interests with whatever condition you're struggling with. Or perhaps you're just fine and the testing is intended to confirm that I'm fine. I went, got my physical, my doctor ordered a blood test and blood work. We looked at it, everything was good. I'm feeling good about stuff. At the same time, blood testing comes with tremendous pitfalls. I don't say that lightly, tremendous pitfalls, from problematic to life-threatening. If we don't approach it with the proper awareness, one pitfall is that many people have mystery symptoms and yet their blood work is normal, healthy, and stable. because most chronic illness conditions are not detectable through blood work. So that's one pitfall right there. That means basically you got a bunch of symptoms, which your doctor's saying everything looks good on your blood work. For other pitfalls of blood testing, keep reading, which I'm going to do. With any condition, it's important to bring awareness to the limitations of the tools we're using to diagnose and treat the illness. For anything that's brain related, that's especially true, with diagnostic and treatment tools having even more potential to be compromising. We're talking about how when we're sick, we get our blood tested. So let's go into it a little bit. I hope you guys are interested in this, because this information has helped a lot of people. So it really brings clarity. So let's cut into it a little bit more. A major aspect of blood testing that's overlooked in the health industry is excessive blood draw and wastage. Our blood is treated like it's disposable. It's not respected. So when someone gets a blood test, there's always too much blood drawn for what's being tested, and blood ends up discarded and thrown away, as though our blood is not actually a valuable resource. And our blood is a valuable resource. No one questions it. No one questions the excessive amount of blood taken from the human body of someone who's in a weakened state. No one questions where the extra blood goes that's not being used. So someone's in a weakened condition. They're dealing with a chronic issue, chronic condition, maybe a chronic autoimmune condition they've been diagnosed with. And their blood is being thrown away as if it's disposable. We're even told it's healthy for our body to get our blood drawn. Don't get me started with that one. That's a really good one. That it cleans up our blood, that fresh blood is produced as if this is a good thing. We're told our blood is refillable practically instantly. I don't know if you've been told that, but a lot of people are told that. We're told everything will be back to normal almost right away. They act like our blood is refillable within minutes or hours. It's not that easy, though. Just because you add water to your bloodstream, I just had 40 vials of blood taken from me. I'm going to bring some water in. The doctor said, just keep on drinking a little bit. Make sure we get, a couple good glasses of water and a chocolate chip cookie. That'll take care of it and bring it all back in. Apologize for the sarcasm with that one. Just because you add water to your bloodstream by drinking fluid and work on boosting your blood sugar by eating some form of sugar doesn't mean your blood is back to normal. It could take weeks or even months to restore. Now think about that. Weeks or even months to restore. Well, if you're somebody with a chronic illness, that's not a good thing. You're someone really sick with a lot of neurological conditions, or you're stuck on Mattress Island a lot, a medical medium term, Mattress Island. If you're somebody really struggling, that's really a tricky situation it becomes. A fraction of the blood taken for blood testing is used for the test itself. Fraction. I'll show you, do a little demonstration. The blood that's left is discarded. Meanwhile, the person is in a more weakened, vulnerable state because they lost blood that was treated as disposable. Then just as that person starts to regain a little strength as they rebuild their blood, another test is ordered and the drain happens all over again. This happens for many patients without a clue about what's really taken place on how the system is broken when it comes to blood tests and blood draws. It's like, get your blood test again. And you're not even restored from the last blood test. If you're someone who's battling a chronic illness, more blood draws can lead to a more weakened condition. The sicker you become, and this is important, the sicker you become, the more blood gets drawn. And the more frequently the blood gets drawn, it becomes a vicious cycle, worsening your condition more. So if we're really sick and we go get more blood drawn, we get weaker, more vulnerable, and sicker. But then the doctor says, you better get in here because we're concerned. Rightfully so, the doctor's concerned. Compassionate, caring doctor is concerned, but doesn't realize the system's broken. So the patient with chronic illness goes back to the doctor, gets another 7, 10, 12, 15, 20, 25 vials, goes home. They're starting to fall apart. They're starting to weaken and get sicker, maybe triggering new symptoms and so forth, right? Then the doctor says, whoa, we have to get you back in here. Better yet, let's get you to a specialist. So when you get to that specialist, it's another 10, 15, 20 vials. Some people, 28 vials, 38 vials, 40 vials. You see where I'm going? Okay, this next section, critical immune system knowledge. So I'm in Brain Saver, by the way. There's a theory going around that your immune system is all in your gut. I hope nobody's mad at me for saying that. Because everybody is, immune system's all in your gut. The immune system's all in your gut. That's what you'll hear. No disrespect. You probably heard it once or twice in the summit. So there's a theory going around that your immune system is all in your gut. There's no accuracy to it. No science behind this to factually determine that your immune system is in your gut. It's an alternative medicine theory that is considered pseudoscience by conventional medicine. In this case, conventional medicine is right. It is pseudoscience. That pseudoscience aligns with what probiotic companies want us to think. Always making friends. That's what I do. Always making friends. Gut health product companies want you to believe your immune system is all in your gut. And to the alternative medicine world, and even a portion of the conventional medicine world now trying to understand why people are truly sick, the theory seems plausible. Our immune systems are in our guts, and that's the reason everybody is suffering with their health. It sounds like it makes sense, doesn't it? Yeah, that's an easy sell. When they say your immune system is in your gut, they're claiming that microorganisms sitting inside your intestinal tract and on your intestinal tract lining are your immune system. That's where the misconception gets pretty wonky and points to the bigger issue. Gut health products from probiotic companies are claiming you improve your immune system by installing these microorganisms in your gut. Trouble is, microorganisms and probiotics are not immune cells. They're not. Microorganisms and probiotics are not your immune cells. It's critical to know, and I think people don't realize that. Good bacteria in your gut are not immune cells. It's another one that's really important to know. Critical to know, actually. Good bacteria in your gut do not create or feed immune cells. An immune cell won't feed on a good bacteria in your gut. Good bacteria in your gut do not keep immune cells healthy. So immune cells don't depend on their healthy nature from the bacteria in your gut, because the majority of your body's actual immune cells are not sitting inside your intestinal tract alongside your gut's microorganisms. This is critical because we're talking about blood draw and the blood draw agenda. Yes, the largest portion of your immune system is in your torso, because the majority of your body is in your torso. Just because your immune system is within your midsection, though, does not mean your immune system is centered in your intestinal tract. Alternative medicine, and even now conventional medicine, a little bit are confused about this and conditioning everybody that the majority of your immune system is in your gut, meaning your intestinal tract. And that probiotic companies will help you rebuild your immune system by providing microorganisms. The whole concept is grossly mistaken. Now, if you're somebody that believes in this, just please hang on. That's fine. No disrespect, no judgment, nothing of the sort. Just raw information right here to consider. So let's just keep on moving along a little bit. Ask yourself this. If your immune system really is all in your gut and not in your blood system throughout your body, why do they measure your immune cell counts through blood tests? The doctors aren't taking a stool sample every time you visit to measure your quantities of immune cells, are they? It's like you go to the doctor, you're going to get a blood test, and they say, poop here. That's what they do. They don't do that. They don't say, okay, can you go to the bathroom and poop in that bowl or cup, or can you poop in that container and put a lid on it, and we will look at your immune system through that only, right? They don't do that at all. It's the blood. That's the concern. The doctors aren't taking a stool sample every time you visit to measure your quantities of immune cells. They're measuring your immune cells by doing a complete blood count, CBC, through your blood. It goes to show how much confusion there is in this area and how the theory that your immune system is all in your gut doesn't hold up once you start to examine it. The reality is that the majority of your immune system is in your bloodstream, so that your brain doesn't take on an infection. Your bloodstream is patrolled by your immune cells systematically looking for potential invaders, so those invaders don't get to your brain or to your heart. Your brain and heart are the two top dogs that your immune system is looking out for. Those are the top dogs. Plus, your immune system has to cover your lungs, your pancreas, your kidneys, your spleen, of course, your spleen, and more. The majority of your immune cells are not sitting inside your intestinal tract, mingling with probiotics and microorganisms, looking for invaders. The majority of your immune cells are in your blood, your bloodstream, and blood vessels all throughout the entire body. It's me every time. Your lymphatic system also carries a large portion of your immune system. And that lymphatic system wraps around the organs of your torso, including your chest and abdomen. This does not mean your immune system is sitting inside of your gut. A portion of your immune system also resides inside your liver and spleen, although that's not to be confused with the theory that your immune system is centered in your intestinal tract either. The liver and spleen are not part of that equation. Nobody's taught that. You can't live without your brain. You can live without your heart. Sorry, you can't live without your heart. Read that straight. That's why I love to do things live. You can't live without your brain. You can't live without your heart. You can live, there we go, with most of your intestinal tract gone. You can live with most of your intestinal tract gone. I've seen it out there. There's people, lots of them, missing most of their intestinal tract, almost all of their intestinal tract. And they can still have a strong immune system, a strong enough immune system for sure. Stronger than somebody else that has a complete intestinal tract. How's that? I've seen people out there throughout the years, and I've talked to doctors that have seen this too, patients that have had most of their intestinal tract removed because of certain conditions that they've had, suffered from, including accidents and car accidents and so forth. And their immune system is stronger than some people, a lot of people who are sick with chronic illness, bedridden, who have an entire intestinal tract. Because without your intestinal tract, you can still have most of your lymphatic system and you can still have your bones producing a variety of immune cells. You still have your bones producing a variety of immune cells for your blood because your bones are producing a certain amount of immune cells for your blood, not your intestinal tract. So your bloodstream is where the majority of the immune system lies. If it weren't, then blood infections would be the number one cause of death at this point. If your immune system was the majority of it wasn't in your bloodstream, the number one cause of death on this planet would be blood infections. As blood tests are ordered for you, more blood than necessary is removed, which means a large portion of your immune system is removed. I just have to say that again really quick. When you get the blood test, especially you're doing like a large blood test, larger than just a couple of vials, then more of your immune system is being removed. Every time you go to get your blood drawn. And if you're someone who's sick, chances are if you're a vegan, you were sick. I mean, yeah, I get it. There's some people that go vegan because of the whole animal thing. I get it. But most people who go vegan and plant-based, they were sick. Why else would you just throw a cheese pizza out the window and just say, forget it, I'm not going to eat that anymore? Why else would you just throw bacon and eggs and everything else and sausage and everything else out the window? Or any whatever, right? You would throw all that cheese out the window, all of it, because something was going on and you just found your way into the vegan movement, plant-based movement, and so forth. And if you're someone who's sick, removing any portion of your immune system can make you more susceptible to anything from a relapse to worsening of old symptoms to coming down with new symptoms. If you're somebody that's struggling with chronic illness and you're sick, you're getting the blood drawn, you could be up for a relapse and not even have any idea or clue that the blood draws are bringing relapses on. Doctors don't have time or energy or awareness to single out tests and space them out. Takes too much, and it's a hassle because you're a hassle in the end, right? That's what it is. The patient becomes the hassle. See, so, and here's something that's really interesting. They like to get it all done in one swoop. So doctors like to get blood work done in one swoop, especially when you're sick with a condition. Oftentimes, more than 3 vials of blood are drawn at a time, normally 5 to 7. In many cases, 14 and 30 vials. This should be all considered. Part of the reason why the areas of blood testing, blood draw, and the immune system are so void of knowledge. Did you hear that? That's real. That is real. Void of knowledge, void of understanding, and lacking information is because, once again, medical research and science don't know why people are sick. That's why the blood draw business is broken. Because in the end, the industries still don't know why people are really sick. Still don't know. I get it. You might be somebody that's never been sick with chronic illness long enough and seen 20, 30 doctors and been on Mattress Island long enough, been to every specialist, tried everything. You might not be one of those people. And if you're not one of those people and you're just getting a little sick, not too sick, then you went plant-based, vegan, or whatever diet, some clean keto or some like pure clean carnivore diet or whatever you wanted to do. If you're somebody that just shifted gears one way or another, cleaned up your fried greasy foods weren't really that sick. You might be feeling better. You're good. And this doesn't make sense what I'm talking about right here. You're somebody who's been through hell and back. This is going to make a lot of sense. That's why all autoimmune disease is listed as cause unknown. And then theories such as it's all in your genes and your body's attacking itself are thrown into the mix. If that gets you riled up right now, me saying that, just read the Medical Meme series if you can. Or the newer one, you're creating it with your thoughts, where people are sick, nobody knows why they're sick, and they're creating it with their thoughts. And you're not really sick. You just think you're sick, which is now being adopted by the conventional medical world as an option. Why don't they seem to care as they're removing your immune system? So as they're removing your immune system, how come they don't seem to care? Well, they're not really thinking about it that way. Not even doctors realize the immune system's being removed every time you get a blood draw. Not even doctors realize that. I know. Just on this platform alone, ran into a doctor that doesn't really think the immune system comes out in the blood. It's not even on their radar. And why is it critical to realize that the immune system is being removed during the blood draw? Why isn't it critical to realize this? If medical research and science knew why people were sick, which is low-grade and high-grade viral infections such as Epstein-Barr virus causing chronic illness and dozens of autoimmune diseases, maybe they would think twice about removing your immune system. Maybe they would think twice. The very line of defense that keeps the viral infection from getting worse. Here you are, you got fibromyalgia, you got multiple sclerosis, you got psoriatic arthritis, you got eczema, psoriasis, you're suffering and struggling, you got chronic fatigue, you got ME, chronic fatigue syndrome, you're suffering, you're struggling. Why don't we know that removing the immune system in large quantities of blood would be problematic in some way? Blows my mind. And why is it critical to realize that the immune system is being removed during the blood draw? Indeed, viral infections are getting worse in patients who are getting blood drawn, especially excessive amounts of blood, sometimes landing them in bed permanently. Permanently. There are people who ended up in bed permanently because they had one too many taken from them over time. A lot of people who are diagnosed with Lyme disease who went to specialist to another specialist and they got 40 vials of blood drawn, another 20 back to their regular doctor, their internist, another 20. And then finally, it just pushed them over the edge and they were bedridden permanently and couldn't get to the doctor anymore. Whereas before they were fatigued and struggling, yet functioning. That's because as you get sicker, the protocol is to draw more blood. Sicker you get, I'm getting sicker and sicker. I'll just try to get to this doctor one last time. Oh, what? The nurse wants to draw 14 more vials because they're scared because I'm getting sicker and they don't know. Okay, we'll draw 14 more vials because they don't know why I'm sick. In the quest to find answers, and I understand this, and by the way, I respect this. I respect doctors and nurses. I respect the work people are doing in the health field. I know a lot of doctors. I respect the work they're doing. They're also learning medical meme information on this, of how to do it safely, and we're going to get into that in a little bit. In the quest to find answers, you have to go to the hospital again, and to another specialist again, and to another doctor again. The sicker you are, the less functional you are. The more blood is drawn, here you are, even less functional, even sicker, and then more blood is drawn. In fact, even sometimes additional vials drawn on the same day. On the search for the problem, because they only want to help. They want to find out what's wrong. They do care. They are in it to get people better, and they're confused. They're not bad doctors. They're not bad practitioners. They're not bad healthcare workers. They're just confused. They want you better, and they were told, draw more blood if you're sicker. It's not unusual to get 100 vials drawn within a 6-month period. 100 vials. After another blood draw from the 5th specialist, you could end up in bed indefinitely. There's no spotlight on this, yet it happens every day. It's Info bringing it to light all these years. Blood draws accelerate the aging process because they draw from the body's reserves. The more blood taken, the more quickly someone ages. You don't hear that out there. Info again. You just don't hear that out there. I mean, that piece of information right there is unbelievable. And I'm reading it again for the umpteenth time or billionth time, right? Because it's obviously the medical medium book. But when I see that, that should be plastered all over the internet. Right there. Blood draws accelerate the aging process because they draw from the body's reserves. The more blood taken, the more quickly someone ages. Removing large amounts of blood, especially when done frequently, drains the body of its life force, putting a strain on every organ in the body. Medical research and science don't know exactly how much blood can be drained out of someone before they die. Do you know that? There's no exact science to it. What? There's no exact science to that, you guys. Medical research and science don't know exactly how much blood can be drained out of someone before they die. Everyone has a different strength and limitation. There's no exact science. The accuracy of how much blood is appropriate to take is still theoretical and debatable among medical communities, which means it's more important than ever to be cautious about how much blood is removed during blood draws and blood donations, because it's theoretical, it's debatable. The medical world, science and research doesn't know the limitations to what someone, how much blood or so forth, and in different people and body types and different situations. Irresponsible blood draw has led to millions of premature deaths. I didn't say that. Keep them up there. It's a slow death. It can be years of blood draws and chronic illness until you're pushed over the edge and your disease takes over. A plain old blood draw, as it's practiced today, can be enough to act as a trigger to worsening illness. Once again, if you just popped on here, I'm all for blood testing. I know that some people are just going to start freaking out and they'll be like, never get a blood test. AW is against blood testing. That's not it at all. Totally for blood testing. Totally. If someone has chronic illness, they are already weakened and their immune system is already fighting battles. So if someone is chronically sick, they're already in a condition where they're fighting battles. Battles that are not seen by a microscope. Battles that are not seen by medical testing. That's why chronic illness is still a mystery. These battles your immune system is fighting are a large part of why you're sick. People who have autoimmune, that's your immune system battling something else. You're at war. Your immune system's at war internally. Your body's trying to heal. Your immune system is sticking up for itself. Your immune system is sticking up for you. It's trying to protect your organs. Your immune system is exhausting reserves to try to defend you as it keeps low-grade and high-grade viral infections, as well as bacterial infections, under control, while also battling exposure from toxins. Then comes the blood test. A metabolic panel, thyroid panel, CBC, hormone panel, nutritional deficiencies, and more. And now you're in it for 5, 10, 12, maybe 14 or more vials of blood. And in all that blood, your immune cells get stolen from your body, not taken in a mindful or respectful way. Like, whoa, we got to be concerned here. We got to be concerned we're not taking too much immune cells out of this person because they're battling stuff and they're obviously sick. So we should be really careful. That's never considered. This places immense stress upon your bone marrow because your bone marrow has to go into overdrive. Huge point right here. Write notes. You don't want to get the book free at the library or on Amazon, just write notes. Just get your notes down. This places an immense stress upon your bone marrow because your bone marrow has to go into overdrive. Once you get blood work, your bone marrow goes into overdrive because it's burning out its reserves to replace your missing immune system. If they needed all that blood to run a test, it would be one thing. Did you hear that? If they needed all of the blood that they're taking because they really needed it, they had no choice, it would be one thing to consider. Even then, it should still be done differently. Yet they don't need all that blood. Most of the blood drawn is unneeded. So it's thrown away or used in experimental testing for possibly nefarious reasons. This is an antiquated system left unchecked and unbalanced. Just so you guys know. Just like other corruption in our system today, like so many outdated techniques and bodies of medical hierarchy. You don't mind if I have a little sip here? Are you guys riveted? Are you guys bored? Hopefully you're riveted. Let's say here's a question right here. Someone asked, why am I reading from my own book? Am I not allowed to read from my own book? I'm reading from the book that has this agenda, the blood agenda chapter. Okay. It's an incredible chapter. I wanted to share it in this special lecture today in like a lecture style and read the chapter. When you have books like this that I've been blessed to have, truly, that have this kind of information in it, I think it's it suits the situation of reading out of it. Okay. And thank you for your question. I've done dozens of lectures on blood draw, by the way, without the book, without a book, just dozens of them. After general blood tests, specialists may come in and order a lot more blood, wanting an extensive window into anything they can uncover and find. So it becomes this, right? You've already gone to your GP. You've already had blood drawn multiple times, 7 vials, 12 vials, 10 vials, even 15 vials, right? You've already had that. And then your GP or your internist doesn't have answers entirely. You're still sick. You're complaining. You're a patient that's becoming a squeaky wheel. So now it's up to a specialist. Look, we can send you to a specialist, or you go and look for a specialist yourself. You go to a specialist, and that specialist is like, this is my chance. This is my chance to show up those other doctors. Happens every day. This is my chance to be that hero. I'm going to find something in your blood work that those other internists and GPs, general practitioners, did not find. I'm going to be the hero here So we're going to order 30 vials and we're going to look for things no one's looking for at the specialist office. No one's counting, though. Specialist isn't saying, how many vials did you get drawn last week? The specialist isn't like, how much blood did you have a month ago? Because we're counting these vials right now. And we're also monitoring your condition to how really grave you are or what kind of condition you're in the moment. No one's counting. No one cares. No one's saying, whoa, we're removing a lot of blood from you right now, blood that your body needs because you're fighting an infection, as indicated by your Hashimoto's thyroiditis. Or your multiple sclerosis. It's medical medium info about Epstein-Barr being the cause of multiple sclerosis. Eczema, chronic fatigue, lupus, your chronic condition. And no one's saying your chronic condition is a chronic viral infection and we're taking your immune system out. No one's saying that when they're drawing your blood. So we'd better be careful and only remove a little at a time so your condition doesn't worsen. No one's doing that. Are they doing that? Did you go to the doctor after being sick for a long time and they said, whoa, we're counting how many vials you had? We have to be careful here because you need your immune system in that blood to fight whatever it is that you're battling. We have to be very mindful and we have to do this carefully. No one says that. It doesn't exist on planet Earth. Maybe on another planet somewhere it does. Doesn't exist here. No one's doing that, in part because doctors don't even realize you're fighting a viral infection to begin with, unless they're starting to learn it from medical medium information. I know that sounds big of me, but it's a fact. And it's well documented, and the medical medium books published all that stuff out there and more. Some doctors think removing your blood is helping your autoimmune condition because, oh, this is scary right here. It's very scary. But do what your doctor tells you. I'm not saying don't do what your doctor tells you. Listen to your doctors. Do what's right by you and your doctor. But check this out right here. Some doctors think removing your blood is helping your autoimmune condition because they believe your immune cells are attacking your organs and glands. This is why many doctors recommend sick people to donate blood. So, did you know this? And I'm probably going to read that any minute. I'm probably going to get to this point that the majority of people who are donating blood are chronically ill women in this country, in the US, and I'm pretty sure other places too around the world. This is why many doctors recommend sick people to donate blood. They think that lowering their immune cells and rebuilding fresh blood will somehow give them a fresh start. More on donating blood later. This is a mistaken belief. For some reason, medical communities are overlooking an incredibly important point. You have sick patients battling autoimmune disease, and you're telling them to donate blood without realizing their blood could be sick and even infectious, which is not a considerate recommendation for someone receiving the blood. Hemochromatosis is also a condition where doctors commonly recommend donating blood with the intention of lowering your iron levels. Meanwhile, medical science doesn't know the cause of hematomacrosis. In truth, the cause is a chronic viral infection in the bones, and your immune system is a critical part of fighting that viral infection. This is the first time you're going to hear this information about blood draw and your immune system. That is, unless you learn this information through medical medium teachings or through the grapevine from someone who learned it from teachings, possibly even prior to the publication of the medical medium book series. I've been talking about this topic for decades and have gotten a lot of crap for it. Like I said, it's not a friend maker, but it's all part of the curse of being me. I've been talking about this topic for decades because I want people to know as much as possible about how to protect their families and their loved ones and themselves. Okay, so let's cruise a little bit through this a little more. Excessive blood draw is another great mistake of our medical industry. Or is it a mistake? Is it on purpose? What is happening with all the excess blood? Billions of gallons, trillions of gallons over the decades. What is happening to all that excess blood? They're discarding it. Are they discarding it? Maybe. No one would know. They're certainly not using all the blood drawn for a given test. That's for sure. Are they using it on the black market? So I want to show you guys a little bit of this too. Are they using it for genetic testing that's not for the greater good, but geared to harm us? Question mark. Is there a secret society of blood drinkers? Is there? I'm just asking. Is there an extraterrestrial race we're providing blood for to utilize as their food source or for their own experimental testing? Where's all the blood going? Are labs simply throwing the blood away in the garbage can? I mean, if that's it, fine, right? Only a portion of blood donations go to hospitals. Huh. Where's it going? And is the blood drive trucks just dumping it out the back door on the highway? Where do all other millions of gallons go of the blood? Regardless of how leftover blood is discarded, whether it's going down the drain or somewhere else, your white blood cell count takes time to rebuild. That majority of your immune system that's in your blood takes time to rebuild and replenish. It can take weeks. For many people struggling with a symptom or condition, depending on its severity, it can take anywhere from 2 to 6 months or even longer. Now, listen, if you're somebody that can't hang out for this whole talk right here, and you're like now concerned and all this stuff, go to the library, get the book for free, or wherever you can find it, Amazon or wherever, but make sure you have this information so you can learn protocols to protect yourself, and bring the book to your doctor if you'd like. It's like your blood's bank account is being drained, and before you can get enough money back into savings, more is taken. That is, before you can get enough immune system back into your blood, more is taken. So it's like your blood savings bank account is being drained. And then the sicker you get, this is really important, the sicker you get, because a large portion of your immune system is taken from you because it's in your bloodstream, the more blood testing is called for to solve the mystery. Like I said before, the sicker you get, the more blood is taken. The sicker you get, the more blood is taken. Chronic illness is still a mystery, no matter how many experts think they have it pegged. It's still a mystery, leading to the reframe, "We'd better order more blood." Chronic illness still leads to that. We better, quote, "we better order more blood." That phrase is being said right now as we're in lecture in the moment. That phrase is being said around the globe by doctors all around the entire earth right now are saying that right now as we speak in real time. Just like they say, how many babies are born? Every something seconds. Like, what do they say? Right? Something like that. They try to like peg the time clock on it. Yep. We'd better order more blood. This is the vicious cycle I mentioned earlier. Many people have a hard time bouncing back from the continual cycle of blood draws. Some may never bounce back. When someone gets a bad cut, for example, from a broken glass injury or mishandling of a knife, and they lose a lot of blood, it's traumatic to the body. The shock alone from losing what would equal 10 or 14 vials of blood is traumatic to the body. Even a less aggressive cut on the body that leads to blood loss equal to even 7 small vials, that blood loss is still traumatizing to the body. So if you get a bad cut, right? And you got blood coming out and it needs some stitches. You still feel it. You still feel it. Like after you get stitched up, you go home. You don't feel peppy. You don't feel like you feel the loss. The person would need time to recover, and yet we draw this amount of blood out of people without question. We say, oh, drink some fluids later, right? Just have a little something to drink. You lose 7 vials of blood from a cut, you're going to be freaking out like you've never seen. Can you imagine? If you had a cut on your arm and you saw 7 vials of blood worth coming out and dripping all over a floor, you would be screaming. But we're told, hey, don't worry, just drink some fluids, eat some food, build your blood back, acting confident it would happen within hours. It'll be good in a couple hours. We'll see you here in 2 weeks for another blood draw. When you go to a new doctor or specialist, they'll want you to do it all over again, a whole new round of blood panels, regardless of when the last blood draw was. You guys, we lose a substantial part of our immune system every time, unless there's small draws for individual tests separated out over multiple doctor visits instead of trying to get it all done in one swoop. No one's telling anybody to do that. With that more measured approach, we can preserve our immune system. If we had a measurable approach like that, at least a larger amount of it would be protected. Otherwise, getting blood drawn can be that trigger that weakens your immune system, allowing a pathogen to rise up and make you sicker. Preserving our immune system is more important than we realize. There's also hemorrhagic shock to consider. Check this out. Seriously, this is really interesting. There's also hemorrhagic shock to consider. Medical research and science only deem certain levels of blood loss as hemorrhagic shock. The reality is that it can vary from individual to individual. What does that mean? Think about this. Someone with a weaker constitution because of chronic illness can suffer from a mild case of hemorrhagic shock from a large blood draw. No one would know. No one would. There's no exact science to hemorrhagic shock. Like a Lyme disease. And go to this new Lyme doctor. Let me get 30 vials of blood. I'm really sick for like a week, have no idea because hemorrhagic shock happened. No one would know. How would anybody ever know? Others can suffer from mild hemorrhagic shock or even severe hemorrhagic shock from a routine blood donation. How many people donated blood and had a hemorrhagic shock episode? The medical industry is not monitoring the variations and variables of hemorrhagic shock as it relates to blood draw. No one's measuring that. Who's measuring it? No one's doing it. A medium has to talk about it. A guy who's not a doctor has to bring this to the world's attention. They have their one mindset about the level of blood loss that leads to hemorrhagic shock. They don't investigate all the subtle differences, you guys, of hemorrhagic shock that you can go through from large blood draws or testings or donations. Hemorrhagic shock should have a scale from mild all the way to extreme, with consideration of all the different amounts of blood that could create all the different levels of hemorrhagic shock. This is a one-size-fits-all approach and is unchecked by medicine. A lot of one-size-fits-all out there. There just is. All right, draining our brain supplies. Let's talk about that for a couple of minutes. You guys, I just want to say thank you for your patience. Thank you for your patience. We're about to start part 2 of the medical medium lecture. Are you ready? Draining our blood supplies. I'm back. The immune cells in your blood aren't all that's lost with blood draws. Whoa. What about the critical electrolytes needed in your bloodstream? They don't get replaced right away. What about those critical electrolytes that keep your central nervous system in a good place, your brain functioning? Do we think those electrolytes just appear out of nowhere, even if you drink an electrolyte-based drink? It would take hundreds of those drinks to get those electrolytes back where they need to go. Hundreds, if even. So when we get our blood drawn, where do all the electrolytes go? The critical ones that are for the brain. When we consume electrolytes, they need time to find their way to where they're needed. Plus, people already have electrolyte deficiencies, and that's a whole problem on its own. You're chronically sick, have electrolyte deficiencies for a whole host of reasons. We don't just drink electrolytes and find they instantly go to our reserves. It isn't an instant refilling of our bloodstream with electrolytes. It's not like there's a science even behind that that's like you could even know. It's a building process that takes time, little bit by little bit. It takes months of constantly staying with it to replenish deep electrolyte reserves. It takes a long time. Let's just be real. Your hamburger or pizza or keto dinner meal won't restore those deep electrolyte reserves. Everything you've read in this book about neurotransmitters becoming deficient and dehydrated applies to blood draw, if you've read the Brain Saver book. There are also nutritional deficiencies to consider. The critical nutrients that have found their way into our bloodstream from our foods and are on their way to their destinations. All the nutrients we're eating, right? Nutrients such as glucose, our blood sugar, that are needed to keep us in balance, to sustain us and fuel our brain. They get removed as well when our blood is taken. So think about all the different things that are removed when your blood is drawn. We can get nutritional deficiencies faster from blood draws than from poor diet. You could be somebody that has a poor, crappy diet and still sustain more nutrients than someone who's eating good, getting constant blood draws. Someone eating a plant-based diet that's constantly getting blood draws can lose more nutritional reserves than someone who's eating a poor diet who's not getting so much blood drawn. How crazy is that? Ironically, we're often getting a blood test in the first place to see if we're nutrient deficient. And that very blood draw makes us more nutrient deficient. We won't see the extra deficiencies in those blood draw results because the deficiencies occurred from our loss of that blood that was analyzed. Think about that one right there. You won't even see it. As we leave the doctor's office or blood lab, we're far more deficient than we were to begin with, but nobody would know. Nobody would know. Nobody. You're leaving the doctor's office more deficient, or the blood draw place more deficient than you came in, but no one knows. They're not saying, by the way, Mr. Jones, by the way, Mrs. Ferguson, you're leaving here a crap ton less nutrients in your bloodstream and in your organs than you came here with your nutrient. You already had deficiencies you came here with, and we're checking those nutritional deficiencies, but you're leaving here with a lot more nutritional deficiencies. Our caring doctor or healthcare provider unknowingly made us more nutrient deficient. Unknowingly made us more nutrient deficient. And who's testing after that test? Who the hell's testing after that test? Well, I just had I almost swore right there. I just had a crap ton of blood taken from me, and I need to now go get another blood test to find out if I'm less deficient. Like, who's monitoring this stuff? Nobody is. Do you see how like archaic this is? All of it. I know everybody thinks we're so advanced in science and research and alternative medicine. but there's so many holes. It's unbelievable. And I know the vegans think they got it all down out there, most of them, and I get it because, you know, they're doing some really killer stuff, some great stuff, but there's so many holes everywhere. Our caring doctor or healthcare provider unknowingly made us more nutrient deficient. If another blood test were taken immediately after, it would be vastly different. Yet no one does this, seeing that you lose precious nutrients from getting your blood drawn, which is just as well because they'd be draining your blood even more as they try to analyze your deficiencies, because that would be a disaster, right? You'd even get sicker. But think about that. After you get your blood drawn, all those nutrients went out, electrolytes, minerals, trace minerals, everything, like everything just got, right? Like not everything, but a hunk of it came out with your blood. And then the next day, if you got a blood test, you'd see the difference. It would be like, whoa, what happened? Often after performing a blood draw and getting back the test results, a doctor will try to fix us with supplements. These attempts to address deficiencies that do show up in a blood test will not fill the blood's nutritional bank faster than the nutrients are being removed via blood draw. So now you're in the hole. So the patient comes, it's a patient nurse, bring the patient in. So I'm looking at your chart here and you have deficiencies. You have a calcium deficiency. You have other deficiencies. We are going to give you these supplements right now, Mrs. Ferguson. Take these supplements and start restoring your nutrients. They won't restore faster than what was taken in that big old blood test. The doctor is looking at your calcium, potassium, vitamin B12, zinc, vitamin D levels, or levels of many other nutrients. At the same time, they're drawing those nutrients and more out with the blood. I mean, is your mind blowing? Because every time I read this, my mind blows. Because that's incredible information. Then they add supplementation that may not even be of the highest quality, meaning assimilable, absorbable, bioavailable to meet the needs they see. Vitamin C is imperative in this day and age in order to stay healthy and heal chronic illness. Vitamin C is an antioxidant that fuels our immune cells. When blood is taken, we lose a large portion of vitamin C reserves. Think about that one. Whoa. After blood is drawn, any vitamin C reserves in cells, tissue, and organs are quickly released into the bloodstream to help fill in for vitamin C deficiency that has been happening in the bloodstream once a blood's drawn. After this occurs, not only do we still have a deficit of vitamin C in the bloodstream, but now we also have a deficit in the organs, including the brain. So after a blood draw, your brain loses vitamin C reserves that were keeping your brain from getting an infection while also keeping your brain tissue from oxidizing and aging. So your vitamin C is critical, right? That's why if you're on a ship for 4 months and you get no vitamin C, you fall apart. Could even die. I mean, it's happened. If you're on a ship for 6 months or a year and you don't get vitamin C in your diet on any level, I mean, everything goes wrong. Everything. So when you get that vitamin C reserve pulled out of you, it's very difficult what can happen. So there's a next section here. Modern day bloodletting. Let's hit this hard. Let's get revved up for this one. Fasten your seatbelts. That's what I recommend. Fasten your seatbelts, please. Back in the old days, especially the 1600s and the 1700s, bloodletting was popular in conventional medicine. Bloodletting. Sir, you're sick. We're going to cut your vein and drain it into a pan. We're going to do that about 10 times a week. If you survive it, great. If you don't, I'm sorry. You got sick and they cut you and drained your blood into a pan. It wouldn't actually help you recover. And conventional medicine eventually learned that. Conventional medicine learned this. They learned that bloodletting did not help you recover. First, it took a while for them to learn the lesson. Back then, if you didn't heal from a first round of bloodletting, you'd get cut again and bleed into a pan again. A few days or weeks later, if a doctor saw you and you weren't better yet, you'd get cut and bleed into a pan again. Eventually, people would get so sick from bloodletting that they would die. Whether you like hearing this or not, whether you believe it or not, some entity in the medical industry knows that the modern day practice of drawing excessive amounts of blood is similar to the historically outdated practice of bloodletting. Whether you believe this or not, somebody in the hierarchy of medicine on this planet knows that this is just as stupid as it was in the 1700s. You don't have to believe it. I'm never going to judge you. You can call me names, whatever. It's okay. But you got to think about this one. So it's a classified industry understanding. Now, what did I just say? Classified industry understanding. One not shared in medical training or medical schools. They're not sharing this. That the blood draw system we're up against today, we're faced with today, is similar to the bloodletting practice of yesteryear. It's bloodletting continued in a fancy way without telling anyone. Least of all, the well-meaning professionals performing the blood draws. That it's modern day bloodletting. If you disagree with this, ask yourself this. Why do blood tests call for so much blood when only a fraction of that blood is needed? Do you know what that can do? Just that alone. It's not just A1C, blood sugar. You can do a thyroid panel on that alone. Nutritional deficiencies on that alone. You can do a CBC. You can do so much on that alone. That alone. It's all you need. Don't get fooled either by, oh no, they got to make a serum. It's not accurate either. If you disagree, ask yourself this. Why do blood tests call for so much blood when only a fraction of that blood is needed? If your answer is that they may use the extra blood later to run more tests, it's important to know that's not how it works. That's a trick. That's a trick. New tests require new blood. If your answer is that they'll need extra blood to make a serum, that's also not how it works. You don't need to take many milliliters of blood to make a serum. You can make a serum with minimal blood. Much smaller amounts of blood are drawn from infants. Much smaller amounts of blood are drawn from infants, yet they can still use that tiny amount of blood to test for the same thyroid panel as an adult who gets so much more blood taken. I'm scratching my head right there. On that one, wait a minute, why do they need that many vials of blood or that much blood for an adult? And they only need a tiny little bit from a baby to run the same panels. Someone with neurological Lyme disease will usually have so many frequent blood draws that it's a miracle they can get better. One of the scariest things about Lyme disease is the blood draws. For decades, I've watched it out there. An absurdly amount of blood removed from people. It's one reason why most don't get better. Neurological Lyme is just one condition. Cancer patients are also pushed into a lot of blood draws when one of the very factors that causes cancer is chronic infection of specific aggressive viral strains, creating cancer cells from feeding on specific aggressive toxins. Excuse me. Taking the blood is removing the immune cells that keep viral infections and viral cancer cells from spreading. Getting consistent routine blood draws can be challenging, especially to a cancer patient undergoing a bone marrow transplant, which, excuse me, which they already have a compromised immune system. Sorry for coughing in the mic, you guys. As we covered, your brain is meant to be safeguarded by your immune system. The majority of your immune system is in your blood, not in your gut, like alternative medicine theorists love to say to sell their gut health products. No disrespect to anybody that could be selling a gut health product. I support everybody who's selling and doing whatever they want to do, and I support that. Yet theories and trends take precedence over common sense. They miss the mark and don't protect the person who's struggling with symptoms. They don't have your back. They don't have your brain either. Gut health specialists in alternative medicine, whether they practice a blend of conventional and alternative medicine or simply alternative, draw a lot of blood to try to make conclusions as to the treatment or condition of someone's gut. They draw a lot of blood. They're presuming the gut is causing the health problem without understanding what's truly behind their patient's chronic illness. It's trendy theories like that that have allowed modern day bloodletting to take hold and to take someone down a darker path with their sickness. I know that's a bold statement, but we have to be careful with chronically ill people. If you know medical medium books and information, you'll know that it's about protecting the chronically ill. It's not about making friends. It's not about working with trends, being on the trend trains. It's about just making sure people with chronic illness can protect themselves in any way possible. And that's what it's all about. It's always been that. And it's not that blood tests are bad. They're not. There's a way to do it. The information is in Brain Saver to learn. Okay. So I'm just cruising along through it. There's so much information in here, you guys. And I know I want it. I just want to get to some. Okay, here we go. Practical considerations of blood testing. Let's hit that a little bit. If by this point you're thinking that I must not believe in blood testing, know that I do. Because I told you guys, I do believe in it. I said that. I believe in blood testing. I believe in the window it offers doctors and patients. I also believe there's a serious problem with how it's practiced that's prematurely taking people's lives. That problem is being overlooked or purposely ignored. If you think it's too far-fetched that the entire medical world missed, if anybody's reading along with me, I just skipped the menstruation section, which is also incredible, but I'm just trying to skip through here. If you think it's too far-fetched that the entire medical world missed this problem regarding our immune system and blood draw, and that I'm the only one to bring this to people's attention, I agree with you. It does seem far-fetched. Why is it that medical medium is the only one in our health history that has brought this attention or brought this to people's attention? Someone knows. They're just not saying it, meaning somebody in the hierarchy of medicine knows. It's just classified. We're supposed to be so technologically advanced that we can find a murderer through a speck of blood the size of a fine grain of sugar on a pair of jeans buried in a shallow grave 40 years ago. We have technology now with blood where they can dig somebody up that was murdered 50, 60 years ago with denim on, get a scrap of that denim out of their shallow grave, and make a serum off of a grain of sand size speck of dried out blood that was trapped in fibers of denim, and enough to run a test on somebody's DNA. For example, to learn family lineage, you don't need to put a big tube of blood in a box and ship it out. You can stick a swab in somebody's mouth. This is to say that with all these medical advances, you don't need a large tube of blood to find a nutritional deficiency, you guys. You don't need a large tube of blood to look at somebody's thyroid panel. You don't need a large tube of blood to run a test for someone's A1C. So let's keep our wits about us. Here's a little section that's really cool. What to ask your doctor. I recommend asking your doctor for the minimal blood draw needed for a test and asking if it's possible to come back periodically so that no more than 2 or 3 full tubes of blood are taken per visit. Ideally, a blood draw should be limited to 2 to 3 quarter tubes. Quarter tubes. That would be more close to it right there. I mean, that would be incredible. That would be ideal. You got blood going here. I drew my own blood to do this demonstration. I'm feeling quite dizzy right now. I accidentally drew too many vials and I filled them up, and I need a chocolate chip cookie, and I'm just kidding. Totally kidding. Some people asked, isn't it natural to lose a lot of blood? That's what a period is. Okay, that's a good question right there. I answer it literally in detail in here. It is natural to lose blood, but keep in mind, menstrual cycles isn't just blood. Menstrual cycles is tissue. It's water. A lot of women get dehydrated through cycles too. It's other things besides blood. A small amount of blood can make a very big, like, did you ever, if you drop blood from a cut in a sink with a little bit of water and it just goes, it goes crazy. It turns into what looks like a lot of blood. There are women that do lose a lot of blood during cycles. And guess what? The doctors are concerned. They are concerned. And when women lose too much blood during a cycle, they're looking at possible blood transfusions. But I go into detail about this too. And it is a natural process, but the natural process where the body reframes blood cells. So you have to know that blood loss in a woman's cycle, menstruation, isn't harboring all of the body's immune systems. And that's the miraculous part of the human body, because it is a natural process. And so the immune system has an intelligence where during a cycle, not all of the immune system, not a lot of the immune system isn't in the blood that's going to be discarded. And that's an incredible process all on its own. So, and there's more of that in here that really defines it. If you notice that the phlebotomist happened to fill the tubes less than quarter or halfway with blood, even better. So here's talking about like what to ask your doctor. Ideally, a blood draw should be limited to 2 or 3 quarter tubes, like I was showing you guys. If you have to, 2 or 3 half tubes. Do I have a half tube? Not really, kind of almost. If you notice that the phlebotomist happened to fill the tubes less than quarter or halfway with blood, even better. Now you're going to hear out there, the phlebotomist said the labs won't take it. No, the labs will take it. All the labs will take it. It's starting to change because of the medical medium books. It's starting to change. Now, if you request quarter or half tubes, the phlebotomist or blood lab will likely say they can't use them. They can't use them. They could say that, they could say they have to have full tubes. Sorry, let me read this better for you guys. They could say they have to have full tubes, or they can't run the test or make a serum. That's what they may say to you. This is not true. I repeat, this is not true. A blood lab can test anything using a quarter or half tube of blood or even less. And they will receive that partial tube and use it if the doctor sends it. If the doctor sends it, they will use it, and they'll still throw away all the blood left over. That's how very little they need. Even quarter tube, just throw the rest out. Find a doctor who will send the quarter or half tubes. The blood lab will receive it, utilize it, and do all the testing needed with partial tubes. Even if a blood lab tells a phlebotomist they won't use partial tubes, if that phlebotomist sends quarter or half tubes, the blood lab will then accept it. There are people so dehydrated and can't get out much blood, and the blood labs take them all the time. There are people out there that are so dehydrated, they can't even get blood out of the person. And the phlebotomist will only see a quarter tube and be like, okay, I'll take it and I'll send it to the lab. Happens all the time. Don't get tricked. The lab only needs a small fraction of blood. In reality, the blood lab only needs blood drops the size of a grain of rice or a bean. Although they will refuse dosages that are that small. If you're told you need to get 5 tubes of blood taken, ask for 5 quarter tubes or 5 half tubes. If it's recommended that you can get that you need to get 7 tubes of blood taken, try to get 7 quarter tubes equal to 1.75 full tubes. It's about learning how to protect yourself and advocate for yourself, because you have to. No one's going to do it if you don't do it for yourself. All right, let me get this spot like perfectly right on for you guys. If it's recommended that you get 7 tubes of blood taken, which means they'll do 7 full tubes, try to get 7 quarter tubes equal to 1.75 full tubes, or 7 half tubes equal to 3.5 full tubes. You see what I mean? If you got if they want 7 full tubes and you do half tubes, you're really getting 3.5 full tubes. Makes a huge difference. As a compromise, if they want more blood than that, ask your doctor to single out tests or divide them up and schedule you to come back so you can keep each blood draw within that 2 to 3 full vial maximum. Ideally, less is better, especially when someone's health is compromised. Okay, so refilling the bank, the blood bank inside my body. I also have protocols in here before you get a blood test, protocols after you get a blood test. Blood work is important, and I recommend getting blood work when your doctor is asking for it, as long as it's done responsibly. There are ways to protect yourself, and believe it or not, you're protecting your doctors too. You're protecting your doctor too, whether your doctors realize it or not, because if you get sicker, that doesn't help your doctors. Doctors don't want people getting sicker. They don't want people just coming in, I'm sicker. And then the squeaky wheel, I'm sicker. I saw you last week and I'm sicker. It's hard, right? Most doctors have track records of getting people sicker. It doesn't help their confidence, reputation, or career. If you're getting sicker from their blood draws, it's only hurting your doctors too. Many compassionate doctors feel the blow as their patients are getting sicker. It's why a lot of doctors struggle with drinking. I'm just going to have a glass of wine. I had a hard day at the office. I had a patient that kept on saying they're getting sicker. So I'm going to have a glass of white wine, as you can see here. Oh, it's a vodka. It's a glass of vodka here. I'm a doctor who drinks a lot at night. It's just to lower the stress. That's a coconut water. That is a coconut water, not a vodka. And I did not draw all my blood out for this demonstration. Have to set the record straight. Someone will be like, he drank vodka. Then there'll be an article. He drank vodka. He's a vodka drinker. The medical medium himself drinks vodka. You'll hear it everywhere. I do not drink vodka. Many compassionate doctors. Okay, so many compassionate doctors feel the blow as their patients are getting sicker. So there's drinking more. Yes, it's true. Doctors drink like fishes. It is so true. I'm not saying that about some of these vegan doctors in this summit. I don't know if they drink or not, although I do have an inside bit of information that some of these vegan doctors enjoy plenty of glasses of wine. It is true. And they say the same old shit. They say grapes, antioxidants are good for me. You know, wine is better than this, that. They say the same old stuff. Oh, and it's vegan. They always say that. Well, it's vegan. All right. Okay. Your health going downhill doesn't help your nutritionist. It doesn't help your nutritionist. If your health is going downhill, it's not going to help your nutritionist. It's not going to help your dietitian if you have one. It's not going to help your acupuncturist either. It's not going to help anybody. It's not going to help one who's recommending a clean diet. So it's not going to help any health practitioner whatsoever. Everybody gets the blame as you get sicker. That health coach, it's not going to help them. The nutritionist, the dietitian, the acupuncturist, Chinese medicine doctor, the DO, the medical doctor, the integrative medicine doctor, the functional medicine doctor, is not going to help any of them. Everybody gets the blame as you get sicker, which in turn can make everybody blame you. What do they all do? They blame you. It's your body, your fault. Ma'am, I don't know what to say. You're just getting sicker. We're doing the best we can. It's your body. It's your fault. Let's draw another 20 vials of blood. We're going to draw another 20 vials of blood from you, Mrs. Ferguson, even though you're getting sicker and it's your fault. And next week, we'll draw another 10 vials. Your trainer, nutritionist, dietitian, acupuncturist, naturopath, health coach, general practitioner, functional medicine doctor, they're likely to blame you as you're drawing more and more blood. You're likely to blame them. Not always. It does often happen. Meanwhile, nobody's looking out for the vampire in the room. No one's looking out for the vampire in the room. Will this stay like that? That will actually stay like that. The unmonitored, unchecked, archaic medical system vampire stealing all the blood. It's not the doctor's fault. It's not your fault. It's the vampire, the system. Told you to fasten your seatbelts. Any brain-related symptom or condition that's listed in this book worsens with excessive blood draw because there's hundreds of symptoms in these books you can learn from. As we've covered, blood draws remove critical foundational electrolytes, macrominerals, glucose, trace mineral salts, amino acids, antioxidants such as vitamin C, vitamin B12, and other nutrients, plus oxygen and hormones, along with critical components of the immune system. That's a whole nother thing. If it's all hormones, if all the doctors are worried about hormones, everybody's worried about hormones. Even the vegan doctors, they're worried about hormones. Meanwhile, all that blood draw is pulling all those hormones out, throwing out all the hormone balance. Did anybody ever think of that? Nope. For instance, when someone has anxiety or depression and they get blood drawn, their anxiety and depression tend to immediately worsen that day. You guys, I see it all the time out there. And then continue to worsen for quite some time afterward, usually for a week or a month to a month. if they don't know the tools in this chapter to guard against it. Fatigue and energy problems are also common. The day after a blood draw, someone could be fatigued and not even connect the dots to the loss of blood. That fatigue can last for 2 to 3 straight weeks in seemingly healthy people who are doing routine blood work. If the fatigue is impeding the person's life in any way, they'll often go to the doctor and get new blood drawn. Lord, God. And this will continue the fatigue for another month. And there are protocols in the back of the book about if you had your blood drawn and so forth. And for the chronically ill, the effects of a blood draw can be all the more heightened and long-lasting. Getting excessive amounts of blood drawn can be a trigger that turns any symptom or condition into a burden. So far, we've been talking about the effects of blood loss. There's also another aspect of blood draw which affects people as well. As the needle enters the vein, where are we? Okay. To draw blood, a burst of adrenaline is released and instant fight or flight occurs. Are you totally calm when you get that blood test? Like, does it even matter? It's like, no, everything's fine. Doesn't matter. Everything's great. You're getting ready. You're bracing yourself. Every time it's like little strap on here, nice and tight. And you're just like, crap. Squeeze your palm, make a fist. Okay, relax. Your adrenaline is like flying, like your adrenals are just pumping, like pumping. Fight or flight occurs, which is difficult on anyone who's chronically sick. That may be somewhat fine for somebody who's not sick, chronically ill or struggling, but that is hard on someone who is sick. Can you believe the amount of information in this book? I just can't even believe it, this chapter alone. The aftermath can be a sleepless night for someone chronically sick, rapid heartbeat for the rest of the day or more, and an elevation of neurological symptoms, including OCD, anxiety, depression, and additional fatigue. Adrenaline spikes when you're getting your blood tested, and the needle's in there. Your adrenaline spikes. And then now you're like, your OCD is elevated. Everything is elevated. It's not uncommon for a young woman who's experiencing chronic fatigue and brain fog to see her second or third doctor in 6 months and to get 18 vials of blood drawn at one time with just one of those doctors. That's not to mention another 7 vials drawn with another doctor and another 10 vials drawn with another doctor. It can easily accumulate, adding up to 35 vials of blood in just 4 to 6 months, and that's not the limit. Many young women get more than that. Doctors have gotten script happy with blood draws, especially the specialists who are functional medicine doctors. No disrespect. No disrespect. We have to find balance. The old conventional doctor of yesteryear, 20 to 30 years ago, would order a basic 3 to 7 vials to look at a complete blood count, maybe a metabolic panel, test for cholesterol, blood sugar, and maybe liver enzymes. In contrast, functional medicine doctors of today tend to order anywhere from 7 to 28 vials. And 28 is not the stopping point. Many of them order more than 35 to 40 vials at one time. Dang. With this chapter, I'm not trying to instill fear. If you don't know the stove is hot and you don't know what's going to burn your hand off, you want somebody to tell you. I believe in blood testing. Let's do it responsibly. Let's get it right. We need to respect people and their life force that resides inside of them, their blood. That's your life force. When we take blood, we need to find a balance to start with, and then we need to do better. Quarter and half tubes need to be the standard amongst the future. Anyway, we're all supposed to be about balance, right? You might have heard that in this summit by somebody. Balance, exercise, workouts, yoga, meditations. We're all supposed to be about balance, right? Balance. There's a lot of gurus in this summit. There's a lot of, good doctors. There's a lot of good people, right? Teaching good things out there in the world. We're all about balance, mindfulness, meditations, yoga, workouts, everything in moderation, mindsets. We're also hearing that it's about saying everything's staying in balance. We're practically obsessed with balance, so much so it's balance, balance, balance. And still no one is questioning, is removing a large amount of blood out of balance? Nobody's questioning that. Blood work after blood work after blood work, vials after vials after vials, as someone goes downhill with their chronic illness, no one's questioning that. Is that out of balance? No one's talking about that balance. Everybody's talking about the other stuff. Anyway, it's all good until the person who's sick gets sicker, and that's what it's about, protecting the chronically ill. And the more blood gets taken irresponsibly, the sicker they can get. And that's what it's all about. But it's about, yes, we need our blood examined. We need our blood tests. We need our doctors, all of that. But there's a problem in the system. It's antiquated, needs to be upgraded. That's what we're talking about.